the health department says they're only waiting for 4 more laboratories to submit a complete list of their pending test results. And after that, there's no longer any need to report late cases. To give us a more detailed explanation regarding this, we have Jen Calimon reporting live from Malabon. Good afternoon, Jen. Just to clarify what Usec Vergeire said, how does the case validation process lead to late reporting of cases? Could you give us a quick rundown of this process?
Well, Charles, DOH Undersecretary Rosario Vergeire explains the process of the submission and validation of cases from the laboratories. First, the laboratory sends a full line list of positive patients to the Epidemiology Bureau. Second, the Epidemiology Bureau identifies and removes duplicate entries or errors in encoding. Third, the Epidemiology Bureau identifies new confirmed cases that have not been previously encoded in their system. And last, the Bureau will identify unique positive individuals per laboratory and will compare it to their system. There will be 2 kinds of tagging. First is tagged correctly as unique first case reported by laboratory, and second is tagged as having been first tested and reported in another laboratory. Charles.
All right, thanks for that, Jen. I understand that 38 out of the country's 42 operational labs have submitted complete case reports as of yesterday. Does this mean that the government is now close to eliminating its validation backlog?
Well, Charles, the DOH shared that 38 out of 42 operational laboratories have submitted their daily accomplishment. Well, this is a big improvement compared to 15 out of 42 laboratories last May 31st. And 38 out of 42 laboratories have also submitted their complete line list, and they're still waiting for the compliance of the 4 remaining labs until this Thursday. Now that 38 laboratories have submitted their line list, the DOH discovered that majority of the 23,000 unique positive individuals are duplicates from other laboratories, so they still have to validate first the numbers given by these 38 laboratories, which could take some time. And after validation, the DOH is confident that this number, the 23,000 unique positive individuals, would be close from their actual count. Charles.
Right, Jen, the DOH said that they would only have to report fresh cases once this backlog has been resolved. How would this now affect the DOH's case reporting?
Well, Charles, the department is hoping that all laboratories in the country would be able to submit all the information needed so they can provide more accurate numbers. If the DOH would be able to get all these details from all the laboratories, only fresh cases will be reported daily, which could give us a clearer picture of the COVID situation in the country. And this would also be used as a basis if the COVID response in the country is improving or working. Charles?
All right, Jen, one last thing. Could you kindly clarify the country's actual testing capacity at the moment, and how is this different from the so-called rated capacity of the country?
Well, Charles, the DOH explains that actual testing is different from rated capacity, or sorry, actual testing capacity is different from rated capacity. First, rated or targeted capacity is theoretical capacity of a laboratory or tests that it can make if there will be no other factors or operational issues along the way. As of today, our rated capacity is 34,000 per day. However, Charles, some laboratories cannot reach this number because of some operational issues. On the other hand, actual testing capacity is based on daily testing capacity or daily testing output which laboratories can make. Right now, we have 8,000 to 9,000 actual daily capacity, which is a very big improvement compared to less than 1,000 before. The highest actual actual testing capacity was recorded last May 16, which reached 11,127 tests per day. Charles?
All right, thanks for that, Jen. That was Jen Calimon reporting live from Malabon.